Welcome back to the CCO podcast, your go-to show for insights, strategies, and success tips in the ever-evolving world of medical coding certification, medical billing, and healthcare management. I am Alicia Scott, CPC, CPCI, CRC, and CCO.US Education Director. Today, we're diving into a topic that might not sound glamorous, but is absolutely vital: medical billing audits. But wait, before you cringe at the word audit, let me flip the script for you. Audits aren't just about avoiding penalties. They're an incredible opportunity to enhance your services, boost your revenue, and become a trusted advisor for your clients. In this episode, we'll explore how to take the fear out of audits and turn them into your secret weapon for success. From breaking down popular audit types to uncovering industry trends and showing you how to position yourself as the hero of your client's billing operations, this episode is packed with actionable insights. Whether you're a medical billing pro or just starting out, you won't want to miss this deep dive into transforming challenges into opportunities. So grab your coffee, your notepad, or whatever fuels your focus. Let's get started.
All right, let's lift the curtain on healthcare today.
Ooh, sounds intriguing.
We're diving deep into a world most people don't even consider healthcare audits.
Audits, huh? Not exactly a dinner party conversation starter.
True, but these audits, especially for billing companies, are way more interesting than you might think.
Okay, I'm listening. Convince me.
We're talking accuracy, compliance, and the impact on both patients and providers. It all boils down to making sure everyone gets a fair shake.
So, kind of like the referees of the healthcare system, making sure everyone's playing by the rules.
Exactly.
Do you need more medical certification and business training? Learn more at www.cco.us.
And to guide us on this deep dive, we're turning to CCO's website, a treasure trove of info on all things auditing.
CCO? They sound like they know their stuff.
Oh, they definitely do. And what's fascinating is their approach. It's not just about catching errors, but about making sure patients get the right care and providers are billing accurately.
Sounds like they're taking a more holistic view, focusing on the big picture.
Right. It's about creating a healthier system for everyone, patients included.
Gotcha. So let's break it down. What exactly are these audits?
Well, we often hear about financial audits, right? But it turns out there's a whole universe of them.
A universe. Okay, you've officially piqued my curiosity.
We're talking patient care audits, specialty-specific audits for fields like cardiology and oncology, even surgery coding audits.
Wow, so it's not just about the money. It really does cover every aspect of healthcare.
Exactly, because healthcare is incredibly complex, right? Each audit type is designed to ensure accuracy and compliance in its specific area.
And for billing companies, I imagine it's all about translating those medical services into billable claims, making sure everything lines up perfectly.
Exactly, because if a billing company messes up, it's not just about numbers on a spreadsheet.
Right, it has real-world consequences.
Big time. It can impact a patient's ability to get the care they need or lead to a provider not getting paid for their services.
So a domino effect with potentially serious consequences.
Precisely. And that's why these audits are so crucial. They act as a safeguard, protecting everyone involved.
Protection, good word. They're like the guardians of fairness in the healthcare system.
I like that. And speaking of guardians, I came across this quote on CCO's website from Alicia Scott, one of their experts. She talks about going above and beyond for clients.
Above and beyond, huh? That speaks volumes.
It does. It shows that it's not just about algorithms and spreadsheets. There's real human expertise involved.
It's about understanding the nuances, the complexities of the system. You need that human touch.
Absolutely. And CCO seems to get that. They see themselves as partners, not just auditors.
Partners, interesting. So they're working with billing companies, not just against them.
It seems that way. They understand the pressures billing companies face, constantly changing regulations, complex coding systems, mountains of data.
I can only imagine trying to stay on top of all that must be a nightmare.
Right. And that's where CCO comes in. They aim to collaborate to help these companies improve their systems and avoid future problems.
So it's not just about catching mistakes, but about preventing them in the first place. A much more proactive approach.
Precisely. And that's where the real value lies. Using the insights gained from audits to build a stronger, more reliable billing system.
Okay, so we've established that audits are important for billing companies, but why should our listeners care? What's the takeaway for them?
It's a good question. Think about it this way. Every time you interact with the healthcare system, a billing company is involved.
Oh, I never thought of it that way.
When your doctor submits a bill to your insurance, when you get that explanation of benefits, when you pay your copay, billing companies are working behind the scenes.
So they're like the invisible threads connecting everything together.
Exactly. And these audits are ensuring that the system is working for you, the patient, as well.
Okay, now it's hitting home. So these audits are protecting us from inaccurate billing, helping control healthcare costs, making sure providers are compensated fairly.
It's all connected. One big, complex web.
Makes you appreciate the complexity of it all. So what kind of audits are we talking about specifically? I saw some terms on CCO's website, HCC, FQHC, RHC.
Alphabet soup, right? Let's decode it.
Please do. I'm all ears.
You mentioned HCC. It stands for Hierarchical Condition Category.
Hierarchical condition category. Say that 5 times fast.
I know, right? But basically, it's a system that classifies patients based on their health conditions.
Okay, so it's like categorizing patients based on their needs.
Exactly. And that helps predict healthcare costs, which is important for billing.
Ah, so that's where billing companies come in. They need to make sure those categories are accurate.
Exactly. These audits focus on making sure billing companies are capturing a patient's health status accurately when submitting claims.
I see, because that impacts reimbursement from insurance companies.
Right, and it ensures patients with more complex needs are receiving the appropriate level of care.
So for instance, if someone has a chronic condition like diabetes, that needs to be reflected in the billing codes.
You got it. And if it's not coded correctly, it can throw the whole system off. The provider might not get paid properly, the insurance company might deny the claim, and the patient could end up with a bigger bill.
Wow, so a seemingly small coding error can have huge consequences.
It's a chain reaction. And that's where the expertise of auditors comes in.
They're like the detectives, making sure all the pieces fit together.
Exactly. They know the ins and outs of these coding systems and can spot those potential errors that a billing company might miss.
It's all about accuracy and fairness at the end of the day.
Couldn't have said it better myself.
Attention healthcare leaders, did you know that unresolved billing errors could be costing your practice thousands of dollars every year? At CCO.US, we specialize in surgical and procedural audits, HCC and risk-based services, and even FQHC and RHC audits. These tailored services don't just fix problems, they prevent them, empowering your team to succeed. Schedule your consultation today to uncover missed opportunities and secure your revenue cycle. Call now or visit CCO.US to take the first step toward a stronger, more profitable practice. Don't wait. Your financial future depends on it.
And we're back, folks. Still spelunking through the caverns of healthcare audits.
Before we went away, I was thinking about something you said earlier.
Let me guess, something brilliant. I say a lot of those.
Huh. Well, yeah. But you mentioned how CCO focuses on finding the root causes of errors.
Right. It's not just about pointing fingers. It's about understanding why those errors happen.
Exactly. Working with billing companies to actually improve their systems. So it got me wondering, how often are these audits actually done?
Great question. And it's one a lot of billing companies ask, too. The short answer, according to CCO's website, annually, once a year.
Annually. Okay. That makes sense, I guess.
Yeah. It does when you think about how much healthcare changes, right?
Oh, absolutely. New tech, new treatments, regulations, always shifting.
It's a whirlwind, and billing companies are right in the middle of it, constantly adapting.
So those yearly checkups, so to speak, help them make sure they're staying on track.
Precisely. It's all about keeping up in a very dynamic industry.
Okay, annual audits. I'm with you. But here's another thought that popped into my head.
Hit me with it.
Are these audits actually required? Or is it more of a best practice that companies can choose to follow? Or not?
Ah, good one. And this is where it gets even more interesting. Often, yes, they are required.
Really? So it's not just a suggestion, it's like built into the system.
It's becoming that way, for sure. Healthcare is moving towards this idea of being proactive about compliance.
I see. So not just waiting for problems to pop up, but trying to head them off at the pass.
Exactly. It's about building those safety nets you were talking about earlier.
Right. Especially when you think about all the data billing companies handle. Patient records, billing codes, insurance claims. One tiny slip-up could snowball.
It's high stakes, for sure. Patient well-being, financial integrity, legal stuff. Having those regular checks just makes sense.
It's like that saying, an ounce of prevention is worth a pound of cure.
Perfect analogy. And this required aspect of audits also points to something bigger, I think. A cultural shift in healthcare towards more transparency, more accountability.
That makes sense.
Yeah.
Everyone, providers, billing companies, patients, they all need to trust that the system is working the way it should.
It's about building that trust. And
Right.
audits play a big part.
Okay, so we've talked a lot about why audits matter, but let's zoom in on those billing companies again for a sec.
Back to the front lines, right?
You mentioned all the challenges they face, keeping up with regulations, managing mountains of data. What are some other hurdles they encounter when it comes to audits?
Oh, there are plenty. But one of the biggest, the complexity of coding itself.
Oh yeah, those medical billing codes? Aren't they insanely specific?
You have no idea. Thousands of them. Incredibly detailed. It takes real expertise to get them right.
I can imagine. Like learning a secret language almost?
It kind of is. And to make things even more fun, they change all the time.
No way, really?
Oh, yeah. So billing companies have to have serious training programs constantly updating their coders.
Wow, so it's not like you just learn it once and you're good to go.
Nope, it's a never-ending learning curve. And on top of that, finding good staff is tough.
Oh, right, I bet. Everyone's looking for skilled coders and billers.
It's a competitive market out there. Billing companies need to offer good pay, benefits, room to grow. Otherwise, those talented folks will walk.
It's a lot to juggle. Makes you realize what goes on behind the scenes to keep everything running.
It really does. And then on top of the coding itself, you've got all the different insurance plans to deal with.
Oh, right. Each one with their own quirks and requirements.
It's a maze. Billing companies have to be fluent in insurances to make sure claims are filed right and payments arrive on time.
Like I said, a secret language. Maybe they should have their own decoder rings.
I'd buy one. But seriously, it's about building relationships with insurers, understanding their little nuances, advocating for their clients.
So it's part coding, part diplomacy, part mind reading.
Pretty much. And let's not forget about the tech side of things.
Oh, right. With all that data, I bet software is playing a bigger and bigger role.
You bet it is. There's some seriously sophisticated software out there now. Automating coding, checking for errors, streamlining the whole billing process.
So technology is kind of like their superpower.
It definitely helps. But even with all the fancy software, human expertise is still essential.
Right. It's about finding that balance. Using tech to our advantage, but keeping a human eye on things, too.
Spot on. And that brings us to another challenge for billing companies keeping up with all the tech advancements.
Makes sense. New software popping up every day. They need to stay current.
Absolutely. They got to invest in keeping their systems up to date if they want to stay competitive and efficient.
It's like a never-ending race.
Kind of, yeah. But hey, that's healthcare for you. Always evolving, always pushing the boundaries.
Whether you're managing an ambulatory surgery center, an emergency department, or behavioral health services, staying compliant isn't optional, it's essential. CCO.US offers audits tailored to your specific needs, from ASC and emergency department audits to critical care and behavioral health evaluations. Our expert team helps you navigate regulations, reduce denials, and unlock the full potential of your revenue. Book your free consultation now at cco.us and take the guesswork out of compliance. Let's work together to elevate your practice.
Okay, so we've covered a lot of ground here, from the frequency and necessity of audits to all those challenges billing companies face.
We've been on quite the journey.
But before we go too far, I want to circle back to something we talked about earlier, the human element.
Right. Always good to bring it back to the people.
We talked about CCO's focus on collaboration and root cause analysis.
Their whole partners, not just auditors, philosophy.
Exactly. Can you give us an example of how that plays out in the real world?
Sure. Let's say a billing company keeps making coding errors for a specific procedure.
Okay, so they're messing up, but not on purpose.
Right. During the audit, CCO discovers it's because they haven't been trained on the new coding guidelines for that procedure.
Ah, so it's a knowledge gap, not malice.
Exactly. And that's where CCO's collaborative approach shines. Instead of just saying, hey, you're doing this wrong, they work with the company.
I see. So they help them develop a training program for their coders, specifically focused on that procedure.
You got it. Turning the audit into an opportunity for growth, not just punishment.
That makes so much more sense. It's about learning and improving, not just finger pointing.
It's a much more sustainable approach, wouldn't you say?
Definitely. It shows that CCOs genuinely invested in their clients' success.
Absolutely. Billing companies want a partner who gets it, who's in their corner, helping them navigate this crazy healthcare system.
It's amazing how this seemingly behind-the-scenes process, auditing, has such a ripple effect throughout healthcare.
It's like the butterfly effect, right?
Right.
One small change can have a big impact.
And I think it highlights something really important. We need to appreciate the work billing companies do.
Totally. They're not just number crunchers, they're the ones keeping the financial wheels turning.
Keeping the whole system afloat, really.
Couldn't have said it better myself.
Are you tired of chasing denied claims or struggling with complex billing? CCO.US is here to help. From revenue cycle management to E&M audits and more, we've got the tools and expertise to optimize your practice. When you schedule a consultation with CCO.US, you're not just addressing problems, you're investing in peace of mind, efficiency, and growth. Don't let another day go by without solutions. Visit CCO.US now and discover how we can transform your practice.
Welcome back to The Deep Dive. We've been knee-deep in the world of healthcare audits.
Making sense of all that billing company action, right?
Exactly. But before we wrap up, let's answer the question that's probably on everyone's mind.
The age-old question, what's in it for me?
Haha, precisely. How does understanding all this behind-the-scenes stuff actually impact us, the patients?
That's the million-dollar question. And the answer is pretty simple. Accurate billing protects you.
Protects. Tell me more.
Think about it. If a billing company messes up and, say, overbills you for a procedure, who's left holding the bad?
Oof. Yeah, not a good situation. You're stuck with that extra cost.
Or, even worse, what if they underbill and the provider doesn't get paid enough? That could affect the quality of care you get down the line.
Makes sense.
Yeah.
You don't want corners being cut because someone messed up the billing.
Exactly. So these audits act as a safety net, making sure both patients and providers are treated fairly.
Okay, so it's all about fairness and transparency in the financial side of healthcare.
It's about making sure everyone's playing by the rules and no one gets taken advantage of.
So it's kind of like having a watchdog, even if we don't realize it's there.
Exactly. And the more you understand about how the system works, the more empowered you are as a patient.
So what can listeners do to be more proactive about their own healthcare billing?
Don't be afraid to ask questions. If something on your bill seems off, call your provider or insurance company and get clarification.
It's my right to know what I'm being charged for, right?
Absolutely. It's your health, your money. And if you think there's been a mistake, don't hesitate to dispute it.
Right. There are systems in place for that.
Yeah.
And I shouldn't be shy about using them.
It's all about being an informed and engaged healthcare consumer.
Taking charge of your own health journey on every level.
That's the takeaway I want to leave folks with today. Knowledge is power. The more you understand about this complex world of healthcare, the better.
So the next time I get a medical bill, I shouldn't just blindly pay it.
Nope. Take a good look. Ask questions if you need to. And remember, those billing companies and auditors are working behind the scenes to keep things running smoothly.
So it's like a whole ecosystem working to ensure we get the best possible care.
And if you're curious to learn even more about this fascinating world, I highly recommend checking out CCO's website.
Great suggestion. They've got a wealth of info that can demystify this whole process.
So there you have it, folks. A glimpse into the world of healthcare audits. It's not always glamorous.
But it's definitely essential.
Absolutely. And with that, we'll wrap up this deep dive.
Thanks for joining us today, everyone. Until next time, stay curious and stay well informed.
Thank you for joining us on this episode of the CCO podcast. I hope you're leaving with valuable insights and actionable steps to take your practice to the next level. Remember, the world of healthcare is constantly evolving, and staying ahead means making informed decisions every step of the way. If you're ready to dig deeper into any of the topics we discussed today, or want expert guidance tailored to your needs, the CCO.US team is just a call away. Don't forget to subscribe to the podcast so you never miss an episode. And if you found today's discussion helpful, share it with your colleagues, because together we can build stronger, smarter, and more successful practices. Until next time, I'm Alicia Scott, wishing you success in all your healthcare endeavors. Stay curious, stay inspired, and keep striving for excellence. Thanks for listening.